Most parents see their baby's bowed little legs and panic. They picture something broken, something that needs bracing, something that will need fixing before their child even learns to walk properly. The truth is nothing like that. Dr. Michael Vitale, a pediatric orthopedic specialist at Columbia University, has spent years reassuring parents about exactly this. What looks like a problem is, in almost every case, simply how the human body starts out. Here's the transformation this video promises. By the end, you won't look at those curved little shins with worry. You'll understand what your baby's legs are actually doing, why they're doing it, and when, if ever, it's time to actually pay attention. Because bowed legs in infancy aren't a flaw in the design, they're the design. Babies spend 9 months folded into a space barely bigger than they are, knees tucked, legs curled inward. That posture doesn't just disappear at birth, it travels with them into the world. There are 6 things science has now discovered about bow-legged infants, and every one of them will change how you see those tiny curved legs. From what's actually causing the curve, to the exact age it should straighten on its own, to the rare moments when a bow really is telling you something else. 1. Your baby's legs are bowed because of the position they lived in before birth, not because of anything that happened after. Pediatric researchers at institutions like Boston Children's Hospital have documented this for decades. It's called physiologic bowing, and it shows up in nearly every newborn to some degree. The mechanism is simple. Inside the womb, there's no room to stretch out. The legs fold in, the shins curve inward, and the bones actually remodel slightly to fit that cramped position. Picture your baby curled in your arms right after birth, knees pointed outward, feet almost touching. That curve you're seeing is just the shape of 9 months in a small space. It's not damage, it's memory, written into bone of the home they just left. 2. That curve is expected to peak around 12 to 18 months, right when your baby is pulling up and taking those first wobbly steps. A well-known body of research tracking normal childhood leg development has shown this bowing is often most visible right as walking begins. Not because walking causes it, but because now you finally have a clear view of it. The mechanism here is about visibility, not new curvature. An upright, moving toddler shows off what was always there. Think of those first unsteady steps across the living room, legs curved like a tiny cowboy. Parents often assume walking is making it worse. It isn't. You're not watching a problem develop. You're watching your own particular shape finally step into the light. 3. By around age 2, most children's legs begin straightening on their own, and by 3 to 4, they usually look completely typical. Longitudinal growth studies, including data referenced by the American Academy of Orthopedic Surgeons, show this self-correction as one of the most consistent patterns in early skeletal development. The mechanism is growth itself. As a child bears weight and walks over months and years, the growth plates near the knee respond to that everyday pressure and gradually reshape the bone into alignment. Imagine your child at 18 months with bowed little legs, and then again at 3, standing with knees close together like any other kid on the playground. Same child, same bones, just given time to unfold. Nothing was fixed, nothing needed to be. Time did what it was always going to do. 4. Most of the time, there are no other symptoms at all. No pain, no limping, no distress. That absence of symptoms is itself the sign pediatricians look for. Clinicians trained in pediatric orthopedics, including those cited by children's hospitals nationwide, describe physiologic bowing as symmetrical and painless, with a child who runs, plays, and climbs without any trouble. The mechanism worth understanding is this. Normal bowing doesn't hurt because nothing is actually wrong structurally. It's simply a stage of alignment, not an injury. Picture your baby giggling and toddling across the kitchen floor, completely unbothered by legs that look, to you, dramatically curved. Your child isn't hiding pain. There simply isn't any to hide. 5. There is a smaller group of cases where the bowing isn't just physiologic, where it's one-sided, gets worse after age 2, or comes with a family history of a condition called Blount's disease, or with risk factors like rapid early walking or excess weight on the growth plates. Pediatric orthopedic researchers have identified these as the pattern that warrants a closer look, sometimes with an X-ray to check the growth plate itself. The mechanism here is different. In Blount's disease, part of the growth plate near the knee grows unevenly, so instead of gradually straightening, the curve holds steady or deepens. Imagine a parent noticing that one leg looks more curved than the other, or that the bowing seems to be getting worse instead of better past the second birthday. That asymmetry, that worsening, is the detail doctors are trained to catch early. It isn't something to panic over, it's something to simply have looked at, so a growing body gets exactly the support it needs. 6. In rare cases, bowing is linked to something else entirely, a vitamin D deficiency causing a condition called rickets, where the bones themselves are softer than they should be. Public health researchers have tracked this connection for over a century, and it remains part of why pediatricians ask about diet and sun exposure at well child visits. The mechanism is nutritional, not positional. Without enough vitamin D, bones don't mineralize properly, so they bend under normal weight instead of holding their shape. Picture a routine checkup where a doctor asks a simple question about milk, sunlight, or a vitamin D supplement. Such an ordinary moment, quietly ruling out something that could otherwise be missed. That's the quiet job of these checkups, making sure the ordinary explanation really is the right one. Here's the thing worth carrying away from all 6 of these. Those curved little legs were never a flaw waiting to be corrected. They were a record of where your baby came from and a preview of a body that's already busy building itself into its next shape. You've been watching a process, not a problem. You've been standing beside a body that knows exactly what it's doing, even when it doesn't look like it yet. You've been worrying over something your child's own growth plates are already quietly handling. You've been present for a stage, not a setback. You've been, this whole time, raising a kid whose legs were simply telling the truth about where they started. If this kind of thing helps you understand your child a little better, we post new videos every week about the science behind everyday moments in pregnancy and early childhood. If this one gave you some peace of mind, sharing it or giving it a like helps other parents find the same answers when they're up at midnight worrying over something that's probably just fine. All right, that's it for this one. We'll see you in the next video.